The Artibonite River is Haiti's longest. It's been a lifeline for generations of people here. But now the river is a source of danger because it carries an especially deadly form of cholera. The disease first appeared here, near a United Nations camp in Haiti's central highlands. Scientists say UN soldiers brought cholera from Nepal. The germs spilled from the camp's leaky latrine into a stream, which flows into the Artibonite. Only a week after the first cholera cases appeared, hundreds of people began falling ill 60 miles downstream. One of them was Fifi Jean-Louise.
I first felt it in my head. I couldn't stand up. I was near death.
She lives in Haiti's most fertile region, where rice is the main crop. Farmers channel the Artibonite's water into irrigation canals to nourish their rice paddies. For these farmers and their families, the river's their only source of water, for bathing, for washing dishes and clothes, and for drinking. Access to safe water is now Haiti's most urgent public health problem. People are so desperate for clean water they walk for miles to this small water purification system. It was put in by a group called Water Missions International. But these successes don't always last. A few miles upriver, another small water purifier sits unused. The purifier is broken, a villager says. They're frustrated they can't find someone to fix it.
People were using it until the cholera outbreak. It broke down, and people now were using the water from the river, and they got sick.
That's a bad time to break down.
Yes, we're getting closer to 2 years since it broke down.
Turns out these failures are common in Haiti, and there's nowhere that's safe from cholera now. On Haiti's western peninsula is a place called Petite Rivière de Nipe. The Haitian government built an elaborate clean water system here. But tragically, just before cholera came, the system failed. So people are working on a low-tech solution.
We are putting dispensers for people to get access to chlorine. Avoid disease that people can get from drinking contaminated water.
Soon there will be a lot of these dispensers all over this countryside. But the city of Port-au-Prince is another matter. Millions live in this sprawling city. Simple patchwork solutions won't work here. Pediatrician Vanessa Rousier has many patients who live in the slums of Port-au-Prince.
When it rains, everything mixes. It becomes a soup, which is a perfect breeding ground for every diarrheal diseases, cholera included.
There are no toilets here. People relieve themselves wherever they can. Some use makeshift latrines perched over the sea. Sewage flows through open ditches.
This water is not good for my health. I wish they could find a way to get this water drained out.
It may take decades before Haiti has anything like the water and sanitation most countries take for granted. So Rousier says it would be unconscionable not to use a cheap and effective vaccine against cholera. There's a pilot project to vaccinate 100,000 people in this slum and the Artibonite Valley. But that's only a tiny fraction of the population. Vaccine advocates hope they'll find a way to vaccinate millions.
Everybody agrees that fixing the sanitation problem and giving access to potable water is the answer. But let's be realistic. When is that going to happen, and how many people can we allow to die in the meantime?
Until then, resourceful Haitians get their water wherever they can, from street vendors selling little bags of it, and sometimes from a hole in the pavement.
Marlene Kisa. She's in charge just to avoid people fighting for the water.
Where does it come from?
From a pipe. There's a pipe underground here.
Is it good water?
We are used to it. That's the water we use every day.